Okay, so welcome everyone to this deep dive. And what we're really zeroing in on today is something super important, especially if you're out there running a smaller healthcare organization, maybe a private practice or a small clinic. We are diving headfirst into the proposed updates to the HIPAA Security Rule that are slated to hit in 2025.
Yeah, 2025, that's coming up quickly.
It is. And, we're talking about a world where the cyber threats are evolving, they're getting more and more sophisticated, and on top of that, the regulations are getting increasingly complex. And I'm sure a lot of you listening are trying to juggle all of this. And, I'm guessing you're probably doing it with maybe not a ton of resources.
Yeah, limited resources is the reality for so many healthcare organizations, especially these smaller practices.
Mm.
They're focused on patient care, which they should be, but it often means that things like IT and security can get pushed to the back burner a little bit.
Exactly. So that's why we're here today, to really break down these proposed changes and make sure you're armed with the knowledge, the information, and most importantly, that you're ready to take action. To do that, we've got a really interesting mix of resources we're going to be pulling from.
Yeah, we're going to try to kind of give you a good overall view of this whole thing. So first off, we've got this guide that's super practical from CESO Security, I think it's called 2025 HIPAA Security Rule Guide and Compliance Checklist. Really simplifies the updates and offers some real down-to-earth
Well,
strategy.
to checklist, that's always helpful.
Always. And then we've also got, sort of the foundational stuff, this document. It's like the official outline of how the HIPAA security rule works right now. I think it's just called a deep dive into the HIPAA security rule, but it lays it all out. And then on top of that, we're tapping into some real expertise. We've got a YouTube webinar from Online Audio Webinar, and the guy leading it is Brian L. Turtle, a real pro when it comes to health IT and compliance. He talks really specifically about what these changes that are coming down the pipeline mean and how to think about them.
Awesome.
And just to make sure we're all on the same page, just sort of uh, with the basics of HIPAA security, we've got another YouTube video. This one is from Atlantic.net, and it's a really nice overview of kind of the fundamentals of the rule as it stands today. And to make sure we really dot our I's and cross our T's, we've got a bunch of HIPAA security rule, frequently asked questions, just so if there's anything that's like not quite clear, we can go back and, make sure we've got all the definitions and stuff down.
Okay, so sounds like we've got all our bases covered here. So as you're listening, your mission, should you choose to accept it, is to really understand, like, to the core, what's coming, what's on the horizon with these high pay updates. We're going to pull out the crucial stuff about those security rule updates and then see how they line up with, what the best practices are in cybersecurity, what the experts are saying, and then most importantly, we're going to give you concrete steps, things you can actually start doing now to prepare for these changes. And we're doing all of this while keeping in mind, like, the unique challenges that smaller organizations like yours face every day.
Exactly. We're not going to pretend like this is a one-size-fits-all kind of thing. We know you've got limited budgets. You might not have a huge IT staff, so we're going to be super practical about this.
Perfect. So I guess to kick things off, why are these updates even happening in the first place? What's the driving force behind all of this?
I think it boils down to the fact that healthcare as a sector, as an industry, has become such a huge target for cyber attacks. The threat landscape is constantly changing, getting more and more dangerous. We're talking about sophisticated actors here. And that means that the rules and the regulations that are supposed to protect sensitive data, they need to keep up, they need to be updated to meet those new threats.
Right. It's like an arms race. The bad guys are getting better and the good guys need to get better too. And, one thing that really struck me watching Brian L. Turtle's presentation, it's easy to get lost in the technical details of all this, but he brought up a point that's really important. It's like the fundamental human aspect of UPIA. It's about civil rights, he said. It's about your right as a patient to be able to access your own medical records, to have some say in who gets to see those records, to know if someone's been looking at them, and to just have a basic right to privacy and security when it comes to your health information. And of course, you have the right to be notified if there's a breach, if your data's been compromised. It really puts all of this into perspective, right? It's not just about checking boxes, it's about protecting people.
It is. And just to clarify, today we're really zeroing in on the HIPAA security rule specifically, which is all about how you protect electronic protected health information, what they call ePHI. And that's important to distinguish from the HIPAA privacy rule, which is broader. That covers protected health information in any form, whether it's digital, on paper, even spoken.
All right, so the security rule is really about securing your digital health information. And Brian L. Turtle mentioned that the last major update to HIPAA was way back in 2013 with something called the Omnibus Rule. What was so significant about that update?
The big thing with the omnibus rule was it really made business associates, those companies that, healthcare providers work with, who also handle ePHI, think like your IT vendors or billing services, it made them directly accountable for HIPAA compliance, just like the healthcare providers themselves. So it closed some loopholes that were there before and, aimed to create a more consistent level of protection across the board.
Which makes sense, right? Because so much in healthcare is outsourced these days. And it's like the CISO security guide pointed out, smaller organizations can be particularly vulnerable to these cyber attacks. They're sometimes seen as easier targets because, they may not have those super sophisticated security systems that the big hospital systems do.
Right. And that makes them an attractive target to the bad actors, right? So that kind of leads us to like, what are the specific challenges that smaller healthcare organizations face when it comes to this whole iPay compliance thing, especially with these new updates coming down the pike? What are the hurdles they're facing and what are the real risks if they don't get this right?
Okay, so let's unpack that. The CISO guide really hammered home a point that I'm sure resonates with a lot of our listeners, which is limited resources. They might have really small IT teams or maybe no dedicated IT staff at all, trying to manage all the demands of patient care, plus all this complex regulatory stuff. It can just be super overwhelming. It can really stretch those resources thin. And unfortunately, that can leave some pretty significant gaps in their security.
And it's not just about the technical resources, right? It's also about the expertise. Like iPay is so complex, it's constantly changing, and it can be a full-time job just to keep up with it all, let alone figure out how it applies to your specific situation. And if you don't have that dedicated compliance expertise in-house, it can feel like you're constantly playing catch-up.
Yeah, and then you add in all the other regulations that healthcare organizations have to comply with, and it just becomes this tangled web of rules and requirements. It's no wonder that some folks feel like they're drowning in paperwork.
And on top of all that, we've got this, constantly evolving, ever-present threat of cyber attacks. And like we've been saying, smaller organizations can be seen as softer targets. The bad guys often think, hey, they probably don't have the same level of protection as the big guys, so let's go after them. It's a harsh reality, but it's the world we're living in.
Yeah, and I think it's also important to point out that it's not just about external threats. The CISO Security Guide really emphasized the risks associated with third-party vendors. Like if you're outsourcing your IT or using cloud-based services. I mean, these partnerships are often essential, right? But they can also introduce vulnerabilities if those third parties aren't properly vetted, secured, and monitored.
Exactly. You're trusting them with your data, your patient's data, so you have to be extremely diligent about who you're working with and how they're handling that information.
Okay, so we've talked about the challenges, but let's get real about the risks. If you're a smaller healthcare organization and you don't comply with these updated HIPAA rules, what's the worst that could happen? I mean, besides just having more paperwork to deal with, what are the real-world consequences?
The risks are huge. And for smaller organizations that maybe don't have a lot of financial wiggle room, they can be absolutely devastating. The CISO guide really laid out some scary possibilities. First and foremost, there are the financial penalties. Fines for HIPAA violations can be massive. We're talking millions of dollars in some cases, regardless of whether it was a data breach or just like not having the proper safeguards in place to begin with.
Millions of dollars.
Yeah.
I mean, that could put a lot of smaller practices out of business.
It could, absolutely. And then there's the reputational damage, which is hard to quantify, but it can be just as damaging as the financial penalties. Patient trust is everything in healthcare. If you have a data breach, that trust can evaporate overnight. You could lose patients, damage your relationships with referral partners, and end up with some seriously negative publicity. Rebuilding that trust is a long, hard road.
And it's not just about money and reputation either, right?
Yeah.
There's also the potential for disruption to your day-to-day operations.
Yeah, that's another big one. Think about a ransomware attack, for example. Your whole system gets locked down, you can't access patient records, you can't schedule appointments. It's basically chaos. And the cost to recover from that kind of attack, both in terms of time and money, can be astronomical.
Wow. So not complying is really not an option.
It's not, especially when you consider that not complying actually makes you more vulnerable to attacks. It's almost like you're putting up a sign that says, hey, we're an easy target, come and get us.
Because if you're not taking security seriously, the bad guys know it.
Right. And last but not least, the CISO guide also pointed out that a bad security track record can actually hold your organization back from growing. You might have trouble attracting new patients, forming partnerships, or even getting funding if you can't show that you're taking data security seriously.
So the stakes are high. We've got to get this right.
Mm.
All right, let's get down to brass tacks. What are the key changes to the HIPAA Security Rule that everyone needs to be aware of for 2025?
Right. So the first thing to remember, and Brian L. Turtle was very clear about this in his presentation, is that these are still proposed changes, right? They're outlined in what they call a notice of proposed rulemaking. So things could still change between now and 2025. But this notice gives us a really good idea of where the Department of Health and Human Services is headed, what they're thinking about.
So it's a roadmap, but the final destination could still be slightly different.
Exactly. But assuming things stay pretty much as they are in this proposal, one of the biggest shifts is a move towards mandatory compliance for all the specifications in the rule.
So it's getting stricter.
Definitely. Right now, there's a difference between required and addressable implementation specifications for some of the security safeguards. Addressable basically meant you could implement a different solution as long as it was equally effective. But this update would do away with that flexibility. Every single safeguard that's outlined would become mandatory. No exceptions.
So no more wiggle room.
Not so much.
Okay, got it. So less flexibility, more requirements. What else is changing?
The next big change is all about risk analysis. The proposed rule is going to require a much more in-depth and comprehensive approach to risk analysis. We're talking about a detailed inventory of all your technology assets and complete network maps. You'll need to do thorough assessments to identify any threats or vulnerabilities that could specifically target your ePHI, and then you have to determine the level of risk based on how likely it is that a threat will be exploited and what the potential damage would be if it was.
And Brian L. Turtle really hammered home this point about needing to be super specific in these security risk assessments.
He did. He said these assessments should be happening at least annually, and they need to be thorough. It's not just a quick checklist. It's a deep dive into your systems to see where you're vulnerable.
So a yearly security checkup.
Yeah, think of it that way. And that's not all. There are also some big changes coming for incident response and contingency planning. The updates really put a big emphasis on resilience, on being able to bounce back quickly if something bad does happen.
And that makes sense. When you're dealing with health information, every minute counts.
Absolutely. So one of the key requirements that's being proposed is the ability to restore your ePHI and all your critical systems within 72 hours of a security incident. And to do that, you need to have solid incident response plans that are not just written down somewhere, but regularly tested and updated.
So 72 hours, that's a pretty tight window to get everything back up and running.
It is, and it's going to require a lot of preparation and practice. You can't just wait until something happens and then try to figure it out on the fly.
Right. What about the actual security measures themselves? Are there any updates to the technical stuff?
Oh yeah, for sure. The proposed rule includes a bunch of stronger technical controls. One of the big ones is mandatory multi-factor authentication, or MFA, for every system that has access to ePHI.
So no more just using a simple password?
Nope. It's going to be a two-step process, at least, which is a good thing. It makes it a lot harder for the bad guys to get in.
Yeah, layers of security. And what about encryption?
Encryption's huge. The proposal calls for encrypting ePHI both while it's in transit, meaning while it's being sent over a network, and when it's at rest, meaning while it's stored on a server or device. Brian L. Turtle, he was really adamant about the importance of encryption at rest.
So protecting the data at every stage.
Exactly. And on top of encryption and MFA, they're also proposing more frequent vulnerability scans, at least twice a year, and annual penetration testing. It's basically like hiring ethical hackers to try to break into your system and find weaknesses before the bad guys do.
So really shoring up the digital defenses.
Yeah, making it a lot tougher to crack through. And then there are some specific changes aimed at the vendors and other third parties that healthcare providers rely on so much these days.
Right, because as we said before, they're often the weak link in the chain.
Exactly. So the proposed rules would require business associates to do an annual verification to make sure they've implemented all the required technical safeguards. And they'd also have to notify the healthcare provider, meaning you, within 24 hours of activating their own contingency plans because of a security incident.
So faster notification if something goes wrong on their end.
Right, because the sooner you know, the sooner you can take steps to protect yourself.
Okay. And then the CISO guide also mentioned something about annual compliance audits.
Yep, that's in there too. Basically, they want to make sure everyone is staying on top of things, not just implementing these safeguards and then forgetting about them. And Brian L. Turtle mentioned a couple of other things that might be coming down the pipeline, too. He said there could be a requirement for organizations to regularly test the effectiveness of their security measures, not just implement them and assume they're working.
Oh, that makes sense. And what was the other thing?
Oh, he said group health plans might have to start including documentation about planned system downtime. Like when they're going to be taking systems offline for maintenance.
Just to be transparent.
Right.
Okay, so a lot of changes, a lot to think about. Now, I know we mentioned the HPH cybersecurity performance goals earlier. What exactly are those goals, and how do they relate to these IPA updates?
So the healthcare and public health sector cybersecurity performance goals, or HPH CPGs, they're basically a set of guidelines that HHS put out to help healthcare organizations prioritize the most important cybersecurity practices. They're voluntary, but they're really aligned with what the experts are saying about how to create a strong security posture.
So they're like best practices.
Exactly. And the cool thing is, a lot of the essential goals in the HPH CPGs overlap really well with the proposed HIPAA updates.
So it's all kind of coming together.
It is. So, for example, one of the essential goals is mitigating known vulnerabilities, which means things like keeping your software up to date and patching security holes quickly. Another goal is strong email security, preventing phishing attacks and things like that. And then there's having a basic incident plan in place, knowing what to do if something does happen.
And those all tie into the HIPAA updates, right? Like with the multi-factor authentication and the encryption requirements.
Absolutely. And then there are goals around things like asset inventory and network segmentation, which is basically about understanding what systems you have, where they are, and how they connect to each other. And that ties into the HIPAA requirement for those detailed inventories and network maps.
So if you're following those HPH CPGs, you're already on the right track for complying with the new HIPAA rules.
Yeah, pretty much. You're building a more comprehensive, layered security program, which is the best way to protect yourself. It's not just about checking boxes. It's about creating a culture of security.
Okay, so for those smaller organizations listening, this might all seem pretty overwhelming. Where do they even start? What are some concrete steps they can take now to prepare for all of this?
I think the CISO guide lays out a really good roadmap. It breaks it down into 7 steps, which sounds like a lot, but it's really manageable if you take it one step at a time.
Okay, let's hear it. What's step 1?
Step 1 is to do a gap analysis. And this is where you really have to be honest with yourself. You need to look at your current security policies, procedures, and controls, and compare them to the new requirements that are coming down the pike. Are you doing enough? Are there any areas where you're falling short? Are you managing your asset inventories properly? Are you encrypting everything you should be encrypting? Are you monitoring your vendors effectively?
So a thorough self-assessment.
Exactly. Once you have a clear picture of where you stand, then you can move on to step 2, which is developing a security roadmap.
So planning out how you're going to get from where you are now to where you need to be.
Right. And this is where you prioritize. What are the biggest vulnerabilities? What needs to be fixed first? Are there any areas where you're handling ePHI that's not properly protected? Are your access controls weak? And you need to set realistic timelines for implementing those mandatory changes, like getting MFA in place and conducting that in-depth risk analysis.
Okay, prioritize and plan. Makes sense. What's next?
Step 3 is all about beefing up your technical controls. We talked about encryption and MFA. Those are must-haves. You also need to start planning for those more frequent vulnerability scans and the annual penetration testing.
Right, making sure your digital fortress is strong.
Exactly. And then step 4 is formalizing your incident response plans. What are you going to do if there's a ransomware attack? How are you going to restore your systems and your data within that 72-hour window? And it's not enough to just write it down. You need to test these plans regularly and make sure everyone on your team knows what their role is.
So practice, practice, practice.
Exactly. Step 5 gets into managing vendor risk, which is so crucial. You need to make sure all your business associates are meeting those stricter requirements, that they're doing their annual verifications, and that they're notifying you quickly if there's an incident on their end. You also need to make sure your contracts with them, especially the BAAs, clearly spell out their responsibilities when it comes to protecting ePHI.
So holding your vendors accountable.
Absolutely.
Okay, what about steps 6 and 7?
Step 6 is all about training your staff. Remember, they're often your first line of defense. You need to make sure they understand the new HIPAA requirements, that they know how to spot phishing attempts and other social engineering scams, and that they know what to do if they see something suspicious.
And the last step.
Step 7 is don't be afraid to ask for help. There are experts out there, cybersecurity and compliance specialists, who live and breathe this stuff. Partnering with them can be a huge help, especially for smaller organizations that might not have all the expertise in-house.
Right, because sometimes it's better to call in the professionals. And speaking of professionals, a lot of smaller organizations rely on managed service providers or MSPs to handle their IT needs. What role can they play in helping organizations achieve and maintain IPL compliance, especially with all these new changes?
MSPs can be amazing partners in this whole process. They can handle so much of the heavy lifting when it comes to security and compliance. They can do those risk assessments. They can implement and manage all those technical safeguards we talked about, like access controls and encryption. They can set up data backup and disaster recovery systems. They can monitor your systems for compliance and generate reports. And they can even train your staff.
So it's like having an outsourced IT and compliance department.
Yeah, basically. And the best part is they have the specialized knowledge and experience that a lot of smaller organizations just don't have in-house. So it's often much more cost-effective to work with an MSP than to try to do it all yourself.
And they can help you avoid those costly fines and breaches. Now, I know Brian L. Turtle gave some really specific and actionable advice in his presentation. What were some of the key takeaways that you think our listeners should really pay attention to?
Yeah, he had a lot of great points. One of the biggest things he stressed was that every healthcare business, no matter how small, needs to be doing those annual HIPAA security risk assessments. It's non-negotiable. He also talked about the importance of using HIPAA-compliant telemedicine platforms if you're offering virtual care, and having a clear policy in place for staff who are working from home.
So making sure you're covering all your bases, whether people are working in the office or remotely.
Right. And he also emphasized the importance of encrypting ePHI at rest, just like the SASO guide did. And he gave some really sobering stats about the current threat landscape. He said healthcare is facing more cyber threats than ever before, and email is still one of the main ways that attackers are getting in.
So watch out for those phishing emails.
Definitely. And he also said that ransomware is the #1 cause of data breaches in healthcare right now. That's scary stuff.
Yeah, it is. What about mobile devices? Did he have anything to say about those?
Yeah, his biggest concern with laptops, tablets, phones, all that is theft. He said it's crucial to make sure they're encrypted, so if they do get lost or stolen, the data is protected.
And he had something to say about texting, didn't he?
Oh yeah, he was very clear that you cannot send unencrypted text messages with medical information. It's strictly forbidden. And even if you're just sending appointment reminders, you need to get the patient's consent first.
Okay, good to know. So lots of practical tips. Anything else?
One other thing he mentioned that I thought was interesting is that smaller providers often struggle more with audits. He didn't really say why, but it's something to keep in mind.
Maybe they just have fewer resources to dedicate to compliance.
Could be. But he ended on a kind of reassuring note. He said that even with all these changes, IPA is still a principles-based regulation, which means it's not just about following a strict set of rules. It's about understanding the principles of security and privacy and applying them in a way that makes sense for your organization.
Okay, so let's take a step back for a minute and just revisit the basics of the IPS security rule. The background document we looked at outlined 3 main categories of safeguards that everyone needs to implement. Could you give us a quick refresher on those?
Sure. So the IP security rule is built around 3 pillars, so to speak. The first pillar is technical safeguards. These are all the things you do to protect ePHI in the digital world. Things like controlling who has access to the data, encrypting it, keeping track of who's doing what with audit trails, making sure the data is accurate and hasn't been tampered with, and transmitting it securely over networks.
So the technical stuff. And what's the second pillar?
The second pillar is physical safeguards. These are all about protecting the physical spaces and equipment that house ePHI. Controlling who can get into your building or server room, having policies for using workstations securely, and making sure you're disposing of old devices and media properly so the data can't be recovered.
So locking the doors and shredding the documents.
Exactly. And then the third pillar is administrative safeguards. These are the policies, procedures, and training that you put in place to manage all the other safeguards, the technical and the physical ones.
So the human element of security.
Exactly.
Yeah.
It's about having a clear security management process, doing those regular risk assessments, training your staff on security best practices, and having plans in place for responding to incidents.
Okay, so 3 pillars: technical, physical, and administrative. And we talked about business associate agreements earlier, but it's probably worth emphasizing again how important those are.
Absolutely. Business associate agreements, or BAAs, they're legally required contracts that you have to have with any vendor or other third party that handles ePHI on your behalf. Your IT company, your billing service, anyone like that. And these agreements lay out exactly what their responsibilities are when it comes to protecting your data, and they make sure they're held accountable under IPA.
So it's not enough to just trust them, you have to have it in writing. So as we wrap up this deep dive, what are the key takeaways you want our listeners to walk away with? What do they absolutely need to remember about these HIPAA Security Rule updates?
I think the most important thing is that these updates are coming, and they're significant. They're a direct response to the growing threat landscape, and they're going to require some real effort to comply with, especially for smaller organizations with limited resources.
But it's doable.
Absolutely. It just takes some planning and preparation. So focus on understanding those new requirements, especially the shift to mandatory compliance for everything, the tougher risk analysis rules, the stronger technical controls, and the need to really keep a close eye on your vendors.
And don't be afraid to ask for help, right? There are experts who can guide you through this process.
Exactly. And remember, this isn't just about checking boxes, it's about protecting your patient's sensitive information. It's about building a culture of security in your organization.
So, as you go forward from here, think about how all of these changes connect. How does that more in-depth risk analysis impact your incident response plan? And what's the one thing you could do today, right now, to start closing any gaps you might have? And maybe even think bigger picture. What does all of this mean for the future of data security in healthcare?
Great questions. Those are definitely worth pondering.
Thanks for joining us for this deep dive. We hope you found it informative and maybe even a little bit empowering. We'll see you next time.
See you then.